I'm Dr. Jochelson. I'm the Director of Radiology at the Evelyn Lauder Breast and Imaging Center at Memorial Sloan Kettering Cancer Center. I'm a professor of radiology here, and I do primarily breast imaging with a little bit of PET-CT. So DCIS on a mammogram could look like anything. We primarily have it in our brain that it presents with microcalcifications, and it frequently does. And on these images, I have a big green arrow to show you magnification views of this left breast. And you can see that there are pleomorphic, so different shaped calcifications in the upper outer portion of this woman's left breast. And this is kind of what we think is classic DCIS. DCIS can present as a mass, and it can present as architectural distortion. And sometimes a non-calcified DCIS is missed. And this is one of the primary misses that we have on mammography in women with dense and non-dense breasts, because if there's no calcium, it's hard to see the lesion. So not to just belabor mammography, but there are other modalities that I would like to show that also demonstrate what DCIS can look like. And this is a contrast mammogram. This is a woman who has heterogeneously dense breast tissue, and in those women, we sometimes miss cancers because the tissue masks them. So we do contrast mammography, which is kind of like an MRI in that we give women contrast, and the contrast enhances neovascularity. So sometimes we can find a cancer before a discrete mass is identified. So in this woman, there is no evidence for microcalcifications, but there are actually a couple small enhancing masses. And these were the presentation of her ductal carcinoma in situ. MRI was another way of looking at ductal carcinoma in situ. When we first started doing MRI, we thought we missed ductal carcinoma in situ, and we probably just didn't understand how it presented. But now we frequently do see it. And in this particular patient, you can see what is probably a tiny mass, but primarily an area of non-mass enhancement. And non-mass enhancement is not an uncommon finding with ductal carcinoma in situ. And in fact, sometimes you may see an invasive cancer. This could be an invasive component. And then the NME, non-mass enhancement, may be the presentation of the DCIS. And this is another example of a patient who has extensive DCIS. You can see this whole area of enhancement on this MRI MIP image. So to summarize, DCIS is one of these things that can look like anything. And we think of it as having microcalcifications, but it can present in any way an invasive cancer presents.